Hello, everyone. Welcome to another episode of 2-Minute Emergencies. I am Dr. Leslie, your board certified emergency physician, international speaker, best-selling author, and professional photographer. And I am here today with another episode. I believe this is episode number 20 regarding head injury. So right now I'm coming to you with from a slightly different device. So I would appreciate if you give me any feedback as far as whether this is coming across clearly or not. And if you have any comments, feel free to add them in and I'll be sure to answer them. So today's topic is one that's very important, especially to parents. One of the things that people notice all the time is children, toddlers, they fall. It's part of learning how to walk. It's part of learning how to get around. When do you worry about those falls? So, one of the times we look at, especially, is in infants. Now, infants typically, we're talking about before they're toddlers, falls are the number one cause of head injuries for these children. The second one is one that we fear even more, which is child abuse, but I'm not going to go into that today. So, these falls, they're being carried, they're dropped, they're being transferred from one area to another, and they fall. There's a lot of things we worry about with these small infants because they're not able to talk back to us. They can't tell us what's bothering them. So it is key for us to watch and see their behavior. Are they acting differently? So if you have a child that falls, cries instantly, not showing any change in their attitude, they're their usual happy-go-lucky selves, um, they're able to eat or feed normally, generally, you're not worried. Now, that depends on how far they're falling. Any child who falls more than twice their height is at definite risk. Once they reach that toddler stage, falling from a standing position or definitely from a crawling position generally is not worrisome because of the amount of force for them landing is difficult to cause injury. Now, the exception to that, of course, is if they hit their head on an object. So a very hard object, maybe you have a fireplace that's elevated or something like that, they're hitting their head, that's a different story. So with these toddlers and infants, when to come to the emergency department. Number one, if you have any concern, you know your child better than anyone else. So you know if your child is acting differently. That alone is enough to cause concern for you to bring your child in. It is always better to be safe than sorry. Definitely for children. We're talking about before they can answer questions, you're looking for behavioral changes. So whether all of a sudden they seem to be unsteady when they're trying to walk, if their pupils are different. Now, some children are born, or some people are born with pupils, that's the black areas in the middle of your eyes, of different sizes. If that's normal for your child, fine. But if you all of a sudden see a difference between one eye to the next, that potentially indicates injury. That needs to be seen immediately. If they have a cut, obviously a cut that's bleeding, you can't control the bleeding. Even if they don't have a head injury as in the brain, they have an injury that needs to be taken care of. So whether they're going to need to have stitches or if they need Dermabond, which I shouldn't use brand names, but a where you can actually close the skin with glue, something to that effect, then you need to come in and be evaluated for that. We can take care of that easily. As children grow, first of all, boys are much more prone to head injuries than girls. Most of that is related to sports. Sports injuries are incredibly common, and they're the number one once you get to the adolescent age, very important. The biggest thing we look for in this is, once again, changes in behavior. So whether it be unsteady gait, difficulty concentrating, memory, if they're becoming repetitive, so ask the same questions over again. Obviously, if they have any cuts or anything that need to be repaired, that needs to be seen as well. If you see that they're tired, all of a sudden they're fatigued, they can't stay awake, you have difficulty arousing them, immediately they need to come into the emergency department for evaluation. every single time. You will find that on most organized sports these days, or I shouldn't say it's becoming more common for organized sports these days, that they have an athletic trainer or someone on the sidelines for any of the games. They are trained to be able to evaluate your child. Your pediatrician does see head injuries, of course, but they look for right then and there, that trainer on the sidelines is able to evaluate your child and see if they need to come into the emergency department to be evaluated. With small children, we tend to use a period of observation first. If you notice something strange about your child, you brought them in, we don't immediately do CAT scans for children unless we see some evidence that there's something abnormal. We usually watch them in the emergency department if you're concerned and wait for a couple of hours, make sure they're able to tolerate food or liquid, things like that, before we send them for a CAT scan. If we notice any changes, we're going to go to imaging. The reason we do that is because we don't want to risk exposing children to radiation that's needless. Okay, so we're definitely going to observe them. Going back to older children, so sports injuries, number one cause. Now, everybody always thinks of the word concussion. So a concussion is basically a shaking of the brain, and that has side effects, as you are, I'm sure, are well aware of, as far as similar things, difficulty focusing. They may have some blurred vision. They may have a headache. Um, when it becomes more serious is actually when you have a contusion of the brain, which is actually bruising and subsequent swelling of the brain. That's something for which we would see that on CAT scan, but we would also admit that child to the admit them to hospital for continued observation, possibly even need to see a specialist. So children can also get fractures of the skull. Once again, small children, not common if they're just falling from a standing position, but as they get older, involved in sports, things like that, can definitely cause a fracture of the skull. These are some of the things to worry about just in children. As we get older, we're less prone to head injuries only because of this thickness of the skull is increased, but also we're a little bit more careful, generally speaking. Motor vehicle accidents can definitely lead to head trauma, and that's as we get older. Other than sports, that's another major cause of potential head injury. So a couple of things we can do to prevent these issues. Number one, if you're involved in sports, wearing a helmet. The best way to protect the brain is to wear a helmet. You always want to make sure your child, if they're riding a bike, if they're roller skating, skateboarding, football, most of the sports that are going to involve direct trauma or can possibly lead to direct trauma, you need to have a helmet on. Number two is seatbelt safety. Because if your child, well, first of all, your child should never be in a vehicle without a seatbelt. None of us should. Unless that vehicle is sitting still somewhere, your child should always be belted, as should you. Now, as we get older, if you are on, for any reason, you're on any type of blood thinners, this is extremely important. If you have a head injury, number one, difficulty stopping the bleeding. Because you're on blood thinners, you're more likely to bleed. We need to assess to see if there's anything underlying. So if there has been loss of consciousness, and this goes for any age, where there's loss of consciousness, even if it's brief, we need to know that so we can assess you better. So as you're older, you're on blood thinners, you have any loss of consciousness, you definitely need to have a CAT scan. All right. Now, as we get into the elderly population, we're more likely to do a CAT scan even if you don't have a loss of consciousness. The reason for that is because as we get older, our brains actually do shrink. This does not have anything to do with your losing your function, but your brain does shrink to some degree. And with that shrinkage, you have a little bit of extra space inside of the skull. So if your brain moves around with that sudden jarring movement, you can actually have an injury that until you have bleeding which reaches a certain point or swelling which reaches a certain point, you might not have any major changes in your behavior. So, elderly folks that come in to see us, we're likely to do a CAT scan. So, going back, reiterating on what I was saying, brain injuries need to be evaluated in the emergency department. Head injuries, simple head injuries, a small child falling from a standing position, yes, they may have a little lump or bump, doesn't necessarily require emergency treatment. You know your child, you're going to watch your child and look for any changes in behavior. Now, just so you want to watch for changes in behavior, not just for a couple of hours. If you have a true concussion or contusion of your brain, your symptoms may not start for several hours, and you actually want to watch that child for up to 48 hours. Now, if your child's acting perfectly normal, they're functioning, you're not seeing any changes, they can go to school. If you're an adult, you can go to work, things like that. But if during that 48-hour time period you notice any changes at all, then you need to seek emergency help. So I hope this was able to help you a little bit. I will be talking later on about concussions as far as returning to sports, that in a later episode. But once again, I am Dr. Leslie, your board certified emergency physician, international speaker, best-selling author, and professional photographer. And I bring these tips to you every Tuesday and Thursday at the same time in the hopes of educating you on ways you can stay healthy and safe and staying out of the emergency department. If you have any other questions and would like to reach me, you can also reach me online at www.drlesliesharp.com, and that's for my website. You can follow me on all social media at Dr. Leslie Sharp. Until then, stay healthy, safe, and stay out of the emergency department. Take care.